I would say absolutely. I would say most injuries, if they're significant, are going to require specialization. Yeah, the brain's a different element altogether, though. Number one, it's so delicate, and people have probably seen the movie Concussion or heard about the CTE that people suffer from. I mean, if you think conceptually from an anatomical perspective, you have a soft gelatinous brain contained within a hard skull. And if you're in an accident and you're moving around in this fashion, the brain is subject to being impacted by the inside of the skull. And it can result in a litany of different types of injuries, subdural hematomas, brain bleeds, swelling. We've handled many cases like that. So you're going to need specialization. I'd say one of the initial points is getting a neurologist. Depending on your symptoms, you can have headaches, you can have nausea, you can have neurologic deficits, you can have motor skill deficits. Neurologists are a good place to start with that. Neurosurgeons, obviously, they're brain surgeons. That's what they do for a living. So if you have swelling on the brain and they need to create a flap or do a burr hole to relieve the pressure, and I had a big case out of Turks and Caicos where that happened, where a woman had food poisoning and she fell and she hit her head, and the doctor from it was a resort she was staying at, came and they checked her pupils and they were non-reactive and non-symmetric, and they knew they had a problem, and they brought her to a clinic there. And there was a local resident doctor from South Africa who was there, and he was in over his head. And they got on the phone with a neurosurgeon from University of Miami and said, listen, this is what the patient's presenting with. And that doctor said, if you don't do surgery and remove a part of her skull and relieve the pressure on her brain, she's going to be dead in 20 minutes. And they literally got an engraving tool from a local arts and crafts shop. They did an autoclave in order to sanitize it. And with this doctor from Miami on speakerphone, he directed them on how to do the surgery and save that woman's life. So that is as delicate an area as you're going to get. And there's other kinds of testings. You can have CTs and brain MRIs. They have something known as DTI, diffusion tensor imaging, which is a specialized type of MRI. It's 3D in its color, and it will show if there's any kind of damage to the pathways of the brain, which could lead to more of a mild TBI or traumatic brain injury. So those cases really are a different animal. You could injure your knee and you're going to recover to some level. It might not get totally back to normal, but you'll probably still be functional. You know, when the brain is damaged, it is the most painful of cases to deal with for people. So we treat those very, very specially and make sure that these people are going to the right specialists and getting diagnosed and treated appropriately.